Hi, my name is Maggie.
And I'm Megan, and we're here to talk to you about patella dislocations.
A patellar dislocation is when your kneecap slips out of place. The kneecap can also sublux, which means it slips out of place but slips back again on its own. Patellar dislocations are common injuries among both athletes and non-athletes. It most commonly affects female athletes between the ages of 16 and 20.
In this video, we'll cover the anatomy of the knee, how a patella dislocation happens, who is most susceptible, how you know you have a patella dislocation, and proper treatment and prevention.
Your patella is the triangular-shaped bone at the front of your knee, commonly called the kneecap. It is used both for protection and for assisting with optimal movement at the knee joint. The patella sits in front of your femur, that's your thigh bone, and moves along the patellofemoral groove as the knee bends and straightens. The patella is attached to the tibia by the patellar tendon and to the quadriceps or thigh muscles by the quadriceps tendon. The lateral or outside of the patella is attached to the iliotibial band.
The patella is most often dislocated laterally, meaning it slips out of the patellofemoral groove towards the outside of the leg. Patellar dislocations often occur during awkward rotations of the knee, which may happen while running and changing directions or when dancing. The patella can also be dislocated by a direct blow, such as running into an opponent or landing on the knee. Patella dislocations are common in sport, especially soccer, basketball, and gymnastics. There are a number of factors that may predispose both athletes and non-athletes to a patella dislocation.
People with knock knees or a patella situated higher on the knee are also at a greater risk. Females are more prone to patellar dislocations because our hips are wider than men's. A wider pelvis creates a wider quadriceps angle. Q angles of 25 degrees or greater has been associated with a higher risk of patellar dislocation.
24% of all instances of patella dislocation are related to family history.
Since the patella is attached to the iliotibial band on the lateral side, a tight iliotibial band may contribute to a patellar dislocation. The quadriceps muscles often play a large role in patellar dislocations. The VMO, or vastus medialis obliquus muscle, is the quadricep muscle that attaches to the medial, or inner side of the patella. The VMO muscle helps stabilize the patella and keeps it from drifting laterally. If you have a weak VMO muscle, you may be at a greater risk for a patellar dislocation. A previous patellar dislocation is also a risk factor, so if you've ever dislocated your kneecap before, be extra careful.
When the kneecap dislocates, pain and swelling will occur. Muscle spasms are likely to happen within the first couple of hours. If severe enough, you'll see that the kneecap is displaced. If the kneecap is only sublux, you'll still be able to walk unaided. It is important to go see your doctor, though, for an evaluation. If untreated, it is common that the kneecap will dislocate again.
Ligaments, tendons, and muscles are damaged when the kneecap is displaced. This can cause chronic knee pain even after the kneecap has been repositioned. This pain affects everyday activities such as walking and increases with vigorous physical activity.
Like many injuries, it is easier to prevent a patella dislocation than to rehab your knee after one has occurred.
Genetics may play a major role in the placement of your kneecap. This can't be helped, but there are many other ways to help decrease your risk of a patellar dislocation. It is important to strengthen your quadriceps, especially the VMO and your hamstring muscles. This will increase stability. The leg press and leg extension machines are great for strengthening the quadriceps muscles.
Proper technique is also important in preventing a patella dislocation in sport, as well as stretching before play. When stretching, it is important to focus on the hamstrings and the muscles of the outer leg.
One example of proper technique is to make sure the knees don't go beyond the toes during squats and lunges. Here is a stretch for the hamstrings and a stretch for the muscles along the outer leg. Orthotics are helpful for providing support to the feet, ankles, and knees for those with flat or hyperpronated feet, which can affect knee stability. They should be worn both during sports and everyday activities.
There are two options for treating a patella dislocation. The preferred option is to do rehabilitation exercises to strengthen the muscles around the knee to stabilize the kneecap. In severe cases, surgery may be required to reposition the knee and lessen the pull of the ligaments on the lateral side.
There are many rehabilitation exercises for treating a patellar dislocation. We will focus on just a few to get you started. For these exercises, wrap an exercise band around your ankle and secure the other end by tying a knot in the end and closing it in a door.
Stand facing the door on the leg without tubing and bend your knee slightly, keeping your thigh muscles tight. While maintaining this position, move the leg with the tubing straight back behind you. Do 3 sets of 10. Turn 90 degrees so the leg without tubing is closest to the door. Move the leg with tubing away from your body. Do 3 sets of 10. Turn 90 degrees again so your back is to the door. Move the leg with tubing straight out in front of you. Do 3 sets of 10. Turn your body 90 degrees again so the leg with tubing is closest to the door. Move the leg with tubing across your body. Do 3 sets of 10. Tie the band just below your knee. Bend the knee on the leg with tubing about 45 degrees. Slowly straighten your leg, keeping your thigh muscle tight. Do 3 sets of 10. Along with these exercises, it is possible that a brace and/or taping must be used to stabilize the kneecap. It is important when taping to tape the kneecap to the inner part of the knee.